Visiting hour at Sally Mugabe Hospital, and people are going to see friends and relatives who are sick. Like many public healthcare facilities in Zimbabwe, there are shortages of TB drugs and essential medicines. The government has for decades struggled to fund its public healthcare sector. Rumbidzai Pondamari gets her antiretroviral drugs for free from humanitarian agencies. She worries global cuts to funding and aid could lead to shortages. When she heard her government had rejected a $367 million deal with the United States, she panicked.
Buying pills at the pharmacy costs $15 to $20. I can't afford that. If I stop taking these HIV drugs, I will die.
Government officials in Harare say they refused the so-called health compact because Washington demanded access to Zimbabweans' biological samples for research. Politicians say there is no guarantee Zimbabwe will have access to vaccines or treatments that might be developed from data collected from Africans and sent to the US.
Can't you see that we're going back to the slave trade days, where actually our able and strong men were supposed to go there and help the West in their economic development, because here maybe they were not needed according to them. Those types of racial undertones and slave trade type of attitudes is what we thought were being projected here.
These are some of the African countries in negotiations with the US for billions of dollars in new funding. In exchange, the US wants access to critical minerals and control over sensitive health data. Zimbabwe isn't the only nation with concerns, though. Kenya was the first to sign, but withdrew after a court raised concern about how citizens' personal information would be handled. Zambia halted talks because the deal was tied to sharing sensitive data and control of mining interests. The US says the funds will be released directly to African governments rather than to aid agencies, as was often the case in the past, over a 5-year period. They will support programs on HIV and AIDS, tuberculosis, malaria, and epidemic preparedness. It also says Americans must benefit from the exchange, but it's not clear how. Zimbabwe needs help to fund its HIV programs, but politicians say if that means handing over personal health data, then Washington can keep its money. Haru, Mutasa, Jazeera, Harare.